गुड मॉर्निंग। मैं डॉक्टर दीपांकर बैनर्जी बोल रहा हूँ फ्रॉम आइडियल फर्टिलिटी आईवीएफ एंड जेनेटिक सेंटर प्राइवेट लिमिटेड, जो कि मध्य प्रदेश में स्थित है। ये हमारा एक नया टेक्निक है। नाउ वी आर विथ वाइट बोर्ड। हो सकता है आपको और अच्छे से चीज़ें समझ में आएँ और आपके और फीडबैक्स मिलेंगे तो मैं और अच्छा कोशिश करूँगा, अच्छे ग्राफिक्स दिखा के और अपने चित्र बना के। ये हमारा साप्ताहिक प्रोग्राम है। हम रेगुलर आईवीएफ, इक्सी, ब्लास्टोसिस ट्रांसफ़र और फीटल मेडिसिन और जेनेटिक्स में काफ़ी काम करते हैं। मैं देवेंद्र जी से अनुरोध करता हूँ, प्लीज़ गो अहेड विद द क्वेश्चंस।
Very good morning, sir.
गुड मॉर्निंग।
Is IVF pregnancy possible in 6.9 mm endometrium thickness with trilaminar eco texture and zone 3 vascularity?
It is a very technical question, and definitely I want to explain what happens when we do embryo transfer. And I have taken this classification from, and you can see, if I can bring it over here, if it comes here, then you can see this is the Applebaum scoring. But definitely there are multiple area of vascularity. We usually use our power Doppler method to see the endometrium, and what happens, I tell you. Whenever we do, हम जब भी एम्ब्रियो ट्रांसफर करते हैं तो दिस इज द यूट्रस, और यूट्रस के भीतर ये उसका सेंट्रल लाइन है, एंड दिस इज द एंडोमेट्रियम। इस एंडोमेट्रियम में जब ये बच्चेदानी का मुंह है और हम यहां से एम्ब्रियो ट्रांसफर करते हैं यहां पर, this embryo transfer is done inside the uterus. उसके पहले, before that, I have to make this endometrium with estradiol, that is estrogen. This estradiol makes this length from here to here. We measure it gradually. Usually we give for 10 to 13 days. Most of the time 13 days. It can go up to 17 days also. This lining, a standard called, here you can say this standard is 7 millimeter. Now, is it that 7 millimeter is must for embryo transfer? No. If it is trilaminar, means there are 1, 2, 3 trilaminar, then even what I achieved in 5 millimeter also. But definitely if it is 7 millimeter, more than 7 millimeter, but less than 12 millimeter, again it goes down, pregnancy chances. Now second thing comes, which is this scoring. Frankly speaking, I do color Doppler, but don't believe it too much, because this blood flow into this area, grade 3, grade 1 is just here, grade 2 is just crossing here, grade 3 is here, and grade 4 is near the gland. These visibility of blood flow in the endometrium is partly subjective. How you set your PRF of pulse repetition frequency or scale, whatever machine you are using, for this endometrial blood flow. So don't rely too much on that. It is better that you should have a receptive means, if there is no embryo implantation repeated failure, then do a endometrial receptivity array also. I do that. So these are the methods I believe more in morphology, believe more in the thickness, believe more in the texture before embryo transfer. So zone 3 is a good blood flow definitely, and I feel that it is a good endometrial thickness 6.9 with endometrial blood flow and with good texture. Thank you very much. and we will take more questions after this. Thank you very much for listening.